We try to prevent hospitalizations. That's our main goal, or one of our main goals. And medications are also another very important aspect of seniors today. There's polypharmacy, where that people are taking so many medications, and you would be surprised that they don't even know what they're taking, what it's for. Sometimes they're taking multiple things for the same thing. One doctor's prescribing something and another doctor has no idea. And the side effects are so great that they can cause problems with appetite, with memory, and oftentimes a lot of what you're trying to treat, a side effect can totally work against what you're trying to do. So we often will try to go through the medication list, figure out what they're for, make sure that you know what it's for, make sure the physicians are all on the same page. We make sure that there's a list in the home. Family members also know what they're taking, make sure that they're taking the right thing for the right diagnoses. So we find that we really have to get a great handle on medications, and then also with that is preventing hospitalizations, so that we get really good outcomes that way. And part of that is regular follow-up with the physicians, where the people go to their doctors if they have some form of any little thing that you might not think could be important. We want to have that constant communication with the provider. Maybe if they're not sure if they're taking a medication, or if they've missed a dose, what do I do? Do I take double? Do I skip it? Do I even have to tell my doctor that? So we want to interact with the physician, let them know what's going on, get that communication in with the physician, get them in with the appointment, see if we need to make some adjustments to the plan of care, so that something that could be, that's very minor, we can go ahead and fix, so that it doesn't become that somebody forgot to take their medication to prevent edema, which is fluid buildup. If we can get ahead of that, that can prevent them being in the hospital for fluid overload, which is a really big deal these days for some of our clients. So little things like that, little tweaks that we can do. Also preventing pneumonias, things like that. So that's another big piece that we have to do with our clients as well. And the primary care physicians, that's a big push that they're trying to do well. So it's a very collaborative effort, and then also that helps the family members, because then we can help them, because they sometimes don't know the right questions to ask and they're overwhelmed, so we can kind of step in and be that expert to help them navigate the healthcare system.
The aging population is something we all need to recognize. Right now, the largest portion of our population is over 85 and growing. So they're predicting the next 15 years we're going to have an inundation of workers and home care aides, care managers like we are, to go in and work with clients as they age. And it's to prevent rehospitalizations and emergency room visits, as Liz is saying. One of the things also is the incidence of dementia in the community, and that's occurring a lot with the elderly community, but we also see it at a younger age. So it's good that we're educated and certified by the Alzheimer's Foundation of America to deal with the behaviors of dementia. So that's an integral part of what we do as well. And a lot of times in doing an RN assessment, we do see with the clients that there's something memory related, there's a problem. We can ask questions about orientation and memory issues that kind of is a baseline to get them to a physician to see if there is a diagnosis of Alzheimer's. And dementia is the symptom of Alzheimer's. So there's a lot of, it's an evolving field. It's one that we feel that we are contributing to, and we want to grow this field through awareness in the community and also awareness in the healthcare community. Because a lot of people in the healthcare community do not know that we're available, but it's becoming more and more so. So one of the things with the video is in the San Diego community is to know that we are available, we do these services, we provide the RN assessment. And that is the first step a lot of times to not only head off problems, but also to see what other treatments and medications they might need.